Hey everyone, Steve Milloy here. Robert Kennedy Jr. is on a crusade against chronic disease, and there's nothing wrong with reminding people to take care of their health. Last week, Kennedy had an op-ed in the Wall Street Journal entitled, "Trump Can Make America Healthy Again." I agree with that thought, and we'll get to that at the end of this video, but Robert Kennedy is otherwise writing checks that reality just can't cash. Kennedy made a number of statistical claims in his op-ed. I can't go through all of them in a single video, so I'll try to address them in a series of videos. This video will focus on Robert Kennedy's claim that 6 out of 10, or 60% of adults in America are living with a chronic disease. He has claimed elsewhere that the current rate of chronic disease is 10 times higher than when his uncle was president more than 60 years ago. So what is the basis for this 60% claim? I think I found the source, a 2014 report by the RAND Corporation concluding that 60% of Americans had at least one chronic condition. That result is based on a government survey called the Medical Expenditure Panel Survey, or MEPS. The government started MEPS in 1996, which is more than 30 years after John F. Kennedy was president, so there are no MEPS-type survey data from the early 1960s to compare with the later data. Comparisons work best when they are apples to apples. MEPS is made up of self-reported data. Questionnaires were sent to individuals, physicians, and employers for the purpose of collecting data on healthcare costs and insurance use. Self-reported data are not verified, and people say all sorts of things for all sorts of reasons when you ask them about their health. Self-reported data might not be all that reliable, and everyone has been to a physician where disease boxes are checked just to make sure the visit is covered by insurance. MEPS was also not designed to assess the incidence of chronic disease. It's a survey, after all, about the costs of health care and the use of insurance. The MEPS data were used by RAND for an unintended purpose that may not be appropriate. The bottom line is that MEPS didn't exist until 1996. The data is of dubious reliability, and in any event is not fit for the purpose of assessing chronic disease incidence. That said, it is quite possible that chronic disease rates have increased over the past 60 years, but not necessarily because we are sicker or living unhealthier lives. Chronic disease rates may be higher because of improved and earlier disease and condition detection, shifting diagnostic standards, more surveys, more record keeping, longer lives, more wealth, more insurance coverage, more welfare coverage, a huge healthcare industry, an ever-expanding government health bureaucracy, and just more stressful lives. As to what a President Trump could do, he could certainly make a huge difference to the health of virtually all Americans. How? Not by setting up a new government commission chaired by Robert Kennedy, but by making us wealthier. As sure as the sun will come up tomorrow, wealthier people are healthier than poorer people. Wealthier people eat better, live better, are more educated, have less stress, have more leisure time, exercise more, and see doctors more often. All that makes for more and better health. So beware of fake statistics and the people who recklessly use them. Be careful about believing things celebrities and politicians say about health. Talk to your doctor about your health concerns, and stay up with the latest in the battle against junk science-fueled chronic disease hysteria. Follow me on X @JunkScience and at my website, junkscience.com. Thanks for watching.